I've been walking beneath streetlights. I've been walking, cause I can't find peace on these nights. I've been walking, but my strides are getting slower. Still I'm walking, but I don't know where I'm going. I've been looking for love, but only found deception. Told my secrets to some people who
This is the Polish Ambassador, featuring the Grouch and Scott Mace. Don't get it twisted.
I might be conscious, still I like to fuck.
I like it.
Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect.
Word.
Indulge in deep combo, get hype when she twerk.
What's going on? What's going on? This is your boy Steve Belcher with Urban Health Outreach Media. Thank you for joining me. I'm telling you, this is going to be a good education session because let me tell you, for all the warriors out there watching tonight, God bless you. But look, where else are you going to go and get information? Like when you first started dialysis, you remember walking through the door of the outpatient hemodialysis unit and you had to sign the consent form or that thick paper. Share this broadcast for other warriors and family members. Again, share this broadcast, y'all. But you remember going into the dialysis unit your first day and you had to sign the consent form. You remember seeing something like this when you was on dialysis? When you started, you may not remember, you could have been not feeling well and somebody went with you and they were your legal guardian or they was your representative and signed the consent. But this consent form is the consent for hemodialysis. Every kidney warrior, every kidney warrior that starts dialysis has to sign informed consent for hemodialysis. And when you get into this, right, the way it looks like that, because I got stuff highlighted in yellow, not to take anything away from anyone's insult anyone's intelligence, but it's a lot of medical jargon in here that one may not understand. And when you look at this, you look at it and you're looking through it, and pretty much you just want to sign in and get on dialysis because you don't feel well. You just got discharged from the hospital, and now they come in with a stack of papers, right? Stack of papers, something like this, or a little bit more thick. And you know what it what it has is assignment of medical benefits. It's signing away the insurance to pay them for labs, informed consent. What else, Steve? Advanced directives, patient rights and responsibilities. They may throw in the hepatitis B form and some other stuff that you need to sign, but you want to get on treatment because you don't feel well. This informed consent for dialysis, hemodialysis treatment is very, very important. And I always recommend, well, before that, let me just say this before I get into the meat of this. I just want to put this up here. It's a disclaimer. Education disclaimer: the information broadcast on Urban Health Outreach Media is provided for educational and informational purposes only and is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. And with that being said, let's talk about it, guys. Informed consent for hemodialysis. Let me tell you, over my 33 years of working in kidney dialysis, uh, 10, 23 of those years was as a charge nurse, 10 was as a dialysis technician. And I have admitted over those 23 years, a lot of dialysis patients for hemodialysis to get them to sign this consent form. And I want to tell you, a lot of patients come in, they don't feel well. I done talk with older patients who come by themselves, who may not understand, family members who come with people who may have to interpret it for them, all sorts. But the thing is, this gets lost in the shuffle. And things that happen in dialysis are indicated in this form, and a lot of patients may not know about it. So what I'm going to do tonight, what I want to attempt to do is go over this hemo consent dialysis form as if this was your first day going on hemodialysis, even though you may have been on 6 months, a month, a year, 5 years, and already signed this document, but maybe it could have been something that you missed, something that you didn't understand, that you forgot to ask. And if that's the case, you may hear that tonight. And if you got questions, I got a watch party going on, right? And I got the comments. So if you want to ask me the questions. Again, 33 years of kidney dialysis. I can answer some questions that you may have. I don't know everything, but I do know some things that hopefully can help you understand the process of hemodialysis and for you or your loved one or your family member to live a quality life. All right, so let's get started. Again, I got the watch party going on. Let me tell you something, and I'm not trying to toot my horn or anything like that, but whoever's watching this and whoever will watch this is very fortunate, because once you go to dialysis and you sign this form, it's a wrap. They're not going to go back, and talk to you and re-emphasize and, point out stuff. There's no organization, there's no one right now other than myself that's here at 10:46 p.m. Eastern Standard Time going over an informed consent so you would actually understand it to help you or your loved one or your family member to have a better experience and better understand this process. So you're not going to get this anywhere else. No one is up. No nurse, no dialysis nurse is up this late wanting to educate patients, dialysis patients who you would think know this information, but a lot don't. A lot don't know, and they got this informed consent and they tucked it away and didn't really understand it. And that's okay. That's why I'm here tonight. So let's get started. So this form right here, all right, the informed consent for hemodialysis. One, you sign it in the hospital if you have to get emergency dialysis and you get admitted. When you sign those forms, you sign for treatment, right? But when you go to an outpatient dialysis unit like a DaVita, Fresenius, US Renal Care, ARA, whatever the clinic is, because it's tons out there, right? We're talking about a large world here, overseas, here in the United States. But before a patient starts outpatient hemodialysis treatment, they have to sign this. And the doctor has to write the orders for you to go on dialysis. So what I'm going to do now, I'm going to read this to you as if I was admitting you for outpatient hemodialysis. A lot of times we like to give this to the patient, but again, this is laid up in medical mumbo jumbo jargon that a nurse is supposed to go over with a patient. A lot of times when you go to the Vita, the administrator assistant goes over this information, and she doesn't know this information from a can of paint. If you read in this, an administrator assistant for DaVita or Fresenius that is not a nurse or don't have any clinical or medical knowledge, and they go over this, you may say, you may be reading this, right? And you're saying bacterial contamination of my blood. What does that mean? Do you think she's going to know what that means to tell you in a way that you can understand and have an informed consent of what's really going on? Hell no. No, and don't trick yourself into believing that a administrative assistant, all right, administrative assistant going over informed consent for hemodialysis that contains critical information for you to understand, to know that you're being informed consent. Okay? That's why I'm here. I had the title, the RN, the Masters of Nursing, and the Masters of Science in Health Education. So don't depend on no administrative assistant to go over this. Make sure if you just started dialysis within the last 6 months or a year, and if you still have your paperwork, go back over it and try to understand it, or find somebody with some medical knowledge like myself, you know, and say, hey, what does this mean? But I'm about to go over the informed consent as if you were the patient and I was giving you this information your first day of dialysis. So here we go. Informed consent for hemodialysis. I name a patient. Let's just say Steve Belcher, if I was the patient. I, Steve Belcher, have been informed that my kidneys are not functioning and that I need hemodialysis to sustain my life. I understand that while hemodialysis is a life-sustaining procedure, it is not a cure for kidney failure. If you're watching this, and if you need me to break that down, give me a thumbs up. But that right there tells you right there, I state your name, have been informed. Have you been informed? Have your doctor told you that my kidneys are not functioning and that I need hemodialysis to sustain my life? I understand that while hemodialysis is a life-sustaining procedure, it is not a cure for kidney failure. It's not a cure, guys. Share this video. Share this video, man. We got to get warriors out here. There's 600,000 people undergoing kidney dialysis and 9 people on here. Let's get that information out there to the family members. Okay, moving on. The procedure necessary to treat my condition has been explained to me by my physician. Did your doctor explain this procedure to you? that I'm about to go into? And I understand. Do you understand the nature of the procedure to be as follows? How many people had their physician explain this procedure that I'm about to tell you about? How many? If you're on this broadcast, chime in, because I'm about to break it down to you. If you didn't understand what goes on in dialysis, hemodialysis, and everything that happens, I'm about to tell you right now. So what I want you to do, share this post. Go out, share this post right now, because I'm about to break it down. Do that and I'll be right back.
Oh, I've been walking beneath streetlights. I've been walking, cause I can't find peace on these nights. I've been walking, but my strides are getting slower. Still I'm walking, but I don't know where I'm going. I've been looking for love, but only found deception. Told my secrets to some people.
This is the Polish Ambassador, featuring the Grouch and Scott Nice. Don't get it twisted.
I might be conscious, still I like to fuck.
I like it.
Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect. Indulge in deep convo, get hype when she
Come on, y'all, let's do this. Share this post. I'm about to get into the meat of informed consent for hemodialysis. What you don't know, if you didn't know, what you want to know, I'm about to tell you what your doctor may or may not have told you. Let's get into it. The procedure necessary to treat my condition has been explained to me by my physician, and I understand the nature of the procedure to be as follows. Hemodialysis will clean my blood by pumping it through a device that will remove waste and excess fluids. I understand that hemodialysis involves, among other things, the insertion of tubes and or needles in my veins or fistula or through a catheter, and the use of artificial kidneys to filter my blood. I also understand that, along with the hemodialysis treatment, I may need laboratory tests with an S, radiology and surgical procedures, to assure adequate function of the equipment and effectiveness of the treatment. Did you understand that? Give me a thumbs up if I need to go back over this consent form, because this is what you should have read or what should have been explained to you when you started dialysis. I also understand that, along with the hemodialysis treatment, I may need laboratory tests, radiology, and surgical procedures, my graft, my fistula, my catheter, to assure adequate function of the equipment and effectiveness of the treatment. Make this go viral. How many nurses in the dialysis treatment are telling you this? So let's move on. This is the important part. This is the important part that I'm about to tell you right now. This is what it says. I have been informed. I have been informed that the following risks with an S are associated with hemodialysis, and that while such risks with an S are not common, one or more can occur. Let me go back. One or more can occur and be potentially life-threatening. Now, wouldn't you want to know that if you started dialysis and you didn't feel well? Wouldn't you want to know that? That you're dealing with something that risks are associated, but they say is not common, but one or more could occur. No, can. Like I can go to the store, so that means it can happen and be potentially life-threatening. And that's why I talk about know what's going on in a dialysis unit. Especially when you have a high rate turnover of technician and nurses. Because you can fall into that category that the following risks that I'm about to tell you are associated with hemodialysis. Let's not get it twisted. And that while such risks, they're not common, but one or more can occur and be potentially life-threatening. Let's talk about it. Number one, bacterial and or viral, to include hepatitis B or C, contamination of your blood, which may cause infection or bacterial infection of the blood caused sepsis. How many warriors watching this program had sepsis? It happens. It's real. You need to know about it before it happens. Stop it in its tracks. That's why we want you to be educated, to know what's going on. Are those technicians putting on the gloves? Are they washing their hands? Are they putting hand sanitizer on? Are they putting the mask on if you got a catheter? Number two, this can happen to you. Bleeding due to blood clotting problems or disconnection of blood tubing. And if you don't think the disconnection of blood tubing can happen, talk to Lisa Baxter of the Lisa Baxter Show. And she would tell you her brother died because the connection when he was on dialysis with the catheter came loose and bled to death. You don't think this is serious? This is damn serious. And that's why we're here tonight, 11 o'clock, trying to educate. We want you to be safe. We're not getting paid for this. These people behind me on this screen, they're dedicated individuals. dedicated individuals to try to help you live a quality life in spite of kidney disease. So what else can happen? The destruction or the breakdown of red blood cells known as hemolysis. Yes, if you're on dialysis, this is what can happen to you at outpatient dialysis. Internal bleeding or bleeding from the access site. Infection of my access site, catheter or fistula infections. Introduction of air into my bloodstream. If you don't think that can happen, reach out to kidney warrior Darnell Colley. Darnell Colley, 2-time or 3-time kidney warrior who was on dialysis and the nurse gave him air. Gave him an air embolism. Sent him home and he had a stroke. Shock or cardiac arrest. Yes, shock or cardiac arrest can happen to you on hemodialysis. Allergic and toxic reaction to drugs, solutions, the artificial kidneys, or other equipment used during the hemodialysis treatment. Everybody's body don't act the same. So I don't have the artificial kidney with me, but some people may have allergic reaction going on that. Another thing, clotting of my access or infiltration of my access. So when you sign this document, it's telling you that you can get infiltrated. So if a technician infiltrates you, you can't sue them because they're telling you in the consent form that can happen. You see what I'm saying? That's why you got to know for yourself where to tell them to stick. Stick yourself. Because if somebody stick you and mess up your access, it ain't a damn thing you can do because you signed the paper. It says this can happen. I have been informed that the following risks are associated with hemodialysis and that while such risks are not common, one or more can occur and be potentially life-threatening. Clotting of my access or infiltration of my access. So that's giving the technician or nurse a pass. If they mess up, they mess up. It's the truth. And then the consent form goes on to say, I have also been informed that there may be some side effects with an S associated with hemodialysis related to fluid and chemical changes during or after hemodialysis treatment. How many patients feel bad after treatment or during treatment? That's what it's saying right there. If you didn't know, did they tell you this was going to happen? When you signed up for dialysis, when you went to outpatient treatment, did the nurse tell you about these side effects, or did the administrative assistant tell you about these side effects and how to combat them? Let me go over it. It says, I have also been informed that there may be some side effects associated with hemodialysis related to fluid and chemical changes with an S, during or after the hemodialysis treatment. Some of the side effects with an S are osteoporosis. Look it up. I don't need to tell you what that is. Electrolyte imbalance, headache, nausea, dizziness, fainting, irregular heartbeats, decrease in blood pressure, muscle cramping, and mild confusion. Did anybody emphasize this to you? Then it goes on to say the hemodialysis procedure and the alternatives That's a big word, guys. The alternatives to hemodialysis has been explained to me. What you say, Steve? What are the alternatives? Peritoneal, transplant, home dialysis. Was that explained to you, or was you cattle coded into the outpatient unit, not knowing anything? Not knowing anything, but just heard it right into outpatient hemodialysis, where the doctor can get paid every time he comes by, maybe once or once a week or twice a month, and the facilities continue to bill the insurance company. All along, you could be in the comforts of your own home doing dialysis and still going to work, not missing the beat, but no one told you. That's what this is asking. The hemodialysis procedure and the alternatives to hemodialysis have been explained to me. I understand the alternatives to hemodialysis to be peritoneal dialysis or transplantation, and that I may be evaluated. You see that? And you may be evaluated for either whenever I choose. Whenever I choose. Did you know that? Not when he choose or they choose, but when I choose. Then it goes on to say, I understand that it will be necessary for me to follow certain dietary restrictions. It will be my responsibility to follow these dietary restrictions, and failure to do so can cause bone disease, calcification of my heart. Look it up. Calcification of my heart, blood vessels and skin, heart failure, and even sudden death. Did they tell you that? In addition, I understand that it will be my responsibility to take my medication as prescribed by my physician. The success, listen to that word that they put in this consent form, the success of hemodialysis also depends upon my agreeing to remain on the machine for the prescribed length of time so that my blood can be adequately cleaned. Then it goes on to say, I will immediately notify my physician. So that's giving you a green light. For those who say, I don't want to bother my nephrologist, you go back to the paper that you signed. I will immediately, not tomorrow, not yesterday, not a week from now, but immediately, which is now. If we look immediately up in the dictionary, Webster's, right? And I'm just going to be facetious and do that and tell you what that word means. I'm not taking you for ignorant, but I want to prove a point. immediately says at once, instantly. That's the first one. It's an adverb. At once, instantly. I called immediately for an ambulance. Similar, right away, at once. Number 2, without any intervening time or space. She was sitting immediately behind me. The point is, it says, I will immediately notify my physician of any adverse reactions or problems I may have with regards to these hemodialysis treatment. So if you got a problem at hemodialysis, you call that physician while you on the machine. You call his office. You get his number. You ask him for his pager number. You don't wait for the charge nurse. You call the office. Call Dr. So-and-so. Tell him I need to talk to him. This is my number. That's what you do. You immediately notify him or her of any adverse reactions. You got an infiltration. You got a blood leak. They had to take your dialyzer clotted, and they had to throw your blood away. Anything that interrupted your dialysis treatment, you immediately call your physician and tell him what happened so he would know. Because if you don't, 9 times out of 10, they're not going to say it. They're not going to write down the internal incident report that they're supposed to write when they do something wrong. There's a list of adverse reactions or things that happen to patients that these people are supposed to document and say what happened. Your blood pressure dropped at the end of treatment, they're supposed to document it. Your blood pressure 200 over 110, they're supposed to document it. You fall at dialysis, they're supposed to document it. They infiltrate your site, they're supposed to document it. They discontinue your treatment because you came late and you're supposed to run 3.5 hours and you only ran 3 hours. They're supposed to document it. That interrupted your treatment. But those are the things that patients don't know, but they just go along with it. Don't sell yourself short with this information. I'm telling you from a caregiver's perspective. From 33 years in dialysis behind the scene, I'm going to give it to you raw so you know what to do. You know what questions to ask. You know what actions to take when something comes down and happen to you. Because it haven't happened to you don't mean that it can't happen to you of all the things that could happen on dialysis. It's right there, right in front of you. I didn't just pull it out of a hat. These are the things that can happen if you go to dialysis right now, outpatient, or you do it at home. This is the risk that you're at. Though it's not common, one or more can happen. So you need to share this with your colleagues, with the people in the kidney disease community, because the National Kidney Foundation, DaVita, Fresenius, or any other organization out there is going to show you this and help you understand what you're dealing with and how to push through this when you're dealing with some idiot that just got out of training that don't know what the hell is going on. Your life is at stake, and we take it serious. Then it goes on to say, I authorize repeated hemodialysis treatments unless, now hear me now, unless I specifically revoke, unless I specifically revoke this consent, means stopping treatment if that's what you want to do. Nobody wants you to stop treatment, but if you're a warrior and you're watching this and you may have come to the end of the road and you feel like there's nothing else, you have that right. And don't be ashamed of that right. To stop treatment, as it says, I authorize repeated hemodialysis treatment, meaning repeated coming every 3 days a week, unless I, me, specifically revoke this consent, which means stopping treatment. This consent will be renewed on or about an annual basis. And then it goes on to say, the final paragraph, I have read this, and this is important. This is a very, very important what I'm about to say, so please listen up. It says, I have read this consent and fully understand its contents. I have had a chance to have my questions answered in words I can understand. I hereby execute this consent form freely and with full acceptance and no other contents in it. I also understand this is a legal document. So how many warriors knew their consent form was a legal document and you understand the contents that's in it? Do you understand a bacterial or viral infection that you can get Hep B or C sitting in a chair? Do you understand that your blood cells, they can break down because somebody made a mistake? Do you understand you can have shock or cardiac arrest because somebody made a mistake? Or what about the introduction of air into your system, like what happened to Darnell Carley? Or what about somebody rushing to put you on dialysis and you got a catheter and they don't connect you all the way, and during treatment you moving and you sleep and the lines separate and the blood pump is just pumping your blood out like Lisa Baxter's brother? Do you want that to happen to you? Do you understand this consent form? That's why we're here doing this show. And so once I read all that to you and asked you, do you understand what I read? I want to make sure you understand everything that I read to you when you come to dialysis. Because I'm not going to let you leave without you telling me, you tell me you don't understand this, or what does it mean about transplant or peritoneal, or what do you mean about introduction of air? I'm going to explain how that can happen to you. And then you go on the sign. You see that? You go on the sign. You see where it says the physician, the patient. That's what happens. So with that being said, I was going to go over, but it's I've been on here 45 minutes. If you want, I can go over right quick. patients' rights from this facility where I used to work at. Y'all know where I used to work. I don't need to say the name. But let me, if you never understood your rights or know what rights you have, let me tell you from a well-known top 2 dialysis organization that's traded on the New York Stock Exchange. Use your imagination. These are your patient rights from this organization. To be fully informed of my rights, including privacy rights, responsibilities, and all rules governing conduct related to patient care, services, and financial policies and responsibilities. 2, to be accepted for now check this out, because you remember we talked about cherry picking and patient blackballing. This company says, as a blank patient, I understand I am entitled to the following. 2, to be accepted for admission without regard to national origin or sponsor, race, age, sex, religion, disability, payer, sexual orientation, marital status, or other factors unrelated to the provision of appropriate medical care. How such hypocritical? To be treated with respect, dignity, and recognition of my individuality, choices, strengths, abilities, cultural values, religious beliefs, and personal needs to the extent possible during treatment, and sensitivity to my psychological needs. So what about that one that got mental illness, outburst in the unit? To my sensitivity to my psychological needs and ability to cope with ESRD. So you see how they try to throw that back in your face, but they tell you the rights and responsibilities, how you need to be respected with dignity, right? To the extent and sensitivity to your psychological needs and ability to cope with ESRD. But yet they want to put you out because you have a emotional outburst because of the ESRD. You see what I'm saying? Why you need to sign the petition. Number 4, the right to privacy and confidentiality in all aspects of treatment. The dialysis facility will make accommodations to provide for patient privacy when patients are examined or body exposure is required. For example, privacy screens or curtains. Number 5, to be free from abuse, neglect, exploitation, coercion, manipulation, sexual abuse, sexual assault, seclusion, or restraint, if necessary, to prevent harm to myself or others, or misappropriation of my personal property by the facility teammates. Guys, share this broadcast. Where else are you going to get this information from someone who worked on the inside about your responsibilities and break it down on something they give you to sign that you should be able to take home and know? You got this information at home. Your rights. Don't let them turn this around and use it against you. Number 6, you had a right to receive adequate, safe, sanitary, and efficient dialysis treatment and respectful care by competent personnel in a comfortable environment. Now, let's not get it twisted. All right? Let's not get it twisted. This is your boy. So, as it said, you have a right to receive adequate, safe, sanitary. Does this look sanitary to you? Come on, y'all. Chime in. Does this look sanitary to you? Does this look safe to you? Say if you had diabetes and you wasn't paying attention and you walked into this pipe and you nicked your leg and it didn't heal and you had to get your leg amputated. Does this look safe, sanitary? Does that look sanitary to you, family? Come on now, chime in. Don't let me have to preach your head today. Does this look sanitary to you with that dust on the box of gloves, on the glove box holder on the wall that technicians and nurses use to glove up to do dialysis? Does that look sanitary to you? Come on now, don't let me have to testify here. Does this look sanitary to you? Share this broadcast. Your boy ain't going to hold back tonight. So let's move on. You have a right to receive all information in a way that you can understand. You have a right to receive assistance from a family member, representative, or other individual in understanding, protecting, and or exercising your right. You have a right to be fully informed of all services available in the facility and charges not covered under Medicare or other health insurance as applicable. You have a right upon request, to receive any information which the facility has available related to financial assistance and free health care. Come on now. To be fully informed of my right to execute any advance directive and of blank policy that properly execute and documented advance directives will be honored and carried out in blank facility. You have a right, the right to choose and to change physician. Let me repeat that now. You have a right to choose and to change physician and or treatment facility, provided that the new physician and or facility can reasonably accommodate me. I am advised to confirm that the facility under consideration has been certified by Medicare. How many of y'all knew that? That you can go anywhere you want. Did anybody tell you that? If they haven't, I'm here to tell you. You have a right to know my primary physician is, who he is, and to participate with my primary physician in planning my care. You have a right to know the names, professional status, and experience of the staff who are providing and coordinating my care and treatment. So if you're sitting in a chair and somebody come up to you that you never seen before, from an agency, from a technician coming from another unit, you have a right to know the names, professional status, and experience of the staff who are providing and coordinating your care and treatment. You have a right, upon request, to obtain an explanation as to the relationship, if any, of the facility to any other healthcare facility or educational institutions insofar as that relationship relates to your care or treatment. You have a right to receive a full explanation by your physician, allied health professional, or of the nature of my medical status and the necessity for recommended treatment, appointments, including the risk, side effects, expected outcomes, and other treatment appointment options before giving consent or refusing treatment appointments. You have a right to expect and receive appropriate assessment, management, and treatment of pain as an integral component of your care. 18. You have a right to receive a full explanation of facility policies regarding patient care, including but not limited to certain policies about infectious diseases that may require me to be dialyzed in a separate space from other patients, and policies about visitors and socialization within the facility. Don't get it twisted, y'all. You have a right to know this stuff. Number 19, you have a right to be fully informed about all treatment modalities, including but not limited to transplantation, home dialysis, home hemodialysis, intermittent peritoneal dialysis, continuous ambulatory peritoneal dialysis, continuous cycling peritoneal dialysis, in-facility hemodialysis, in-facility nocturnal hemodialysis, hospice, and the other option of no treatment. Number 20, you have a right to receive resource information for dialysis modalities not offered by the facility, including information about alternative scheduling options for working patients. Number 21, you have a right to be advised of research studies that affect my care and give my informed written consent to participate in such research or refuse to participate. Number 22, you have a right to be informed about whether the facility is participating in any teaching programs and to refuse to allow their participation in my treatment. Number 23, you have a right to be transferred or discharged only for medical reasons, for my own welfare or that other patients, or for non-payment of fees. If I am discharged for these reasons, I will be given advance written notice of 30 days unless the reasons involve issues of immediate safety to other patients or teammates. These actions may result in an immediate discharge. Reasons for involuntary discharge may include failure to comply with items in the patient's standards of conduct, responsibilities, and facility rules, which are provided in the patient's registration packet. 24, you have a right to review my medical records with supervision by the facility administrator or designee, and at a time mutual agreed upon me and the facility administrator or designee in advance. So you can look at your medical records if you want. Number 25, you have a right to receive a copy of your medical records. All requests for medical records will be put in writing based on individual state requirements for assessing medical records. There may be a fee charged for copying the medical records. All records requests will be completed within 30 days of the request. Number 26, you have a right to receive necessary services or referrals as outlined in my individual plan of care. Number 27, you have a right to know my medical records and the information contained will be considered private and confidential and only released in compliance with state and federal law. Number 28, you have a right to freely express comments. Now check this out, y'all. Share this broadcast. Number 28, you have a right, because this what burns me with patient patient discharge, patient blackball, other patients for going to units because patients may have complaints. But listen to this, what this billion-dollar organization says in their patient rights and responsibility to patients that they have you to sign. They say, you have a right to freely express comments, complaints, or grievances verbally or in writing, personally, anonymously, or through a representative of my choosing. My comments, complaints, and grievances may be expressed to facility teammates, administration, blank corporate compliance department, the end-stage renal disease network organization, and appropriate regulatory agencies, check it out, without fear. Let me repeat that. Without fear or reprisal or denial of services. Discrimination or retaliation. All comments, complaints, and grievances will be resolved in a timely manner in accordance with the facility's grievance process. Information regarding the grievance process will be provided to me, and the facility social worker will assist if needed. Well, when you tune in this Thursday night, we will have a social worker who used to work for DaVita that will debunk item 28 as I read it again. Patients have a right to freely express comments, complaints, or grievances verbally or in writing, personally, anonymously, or through a representative of my choosing. My comments, complaints, and grievances may be expressed to facility of teammates, administration, corporate compliance department, the end-stage renal disease network organization, and appropriate regulatory agencies without fear or reprisal or denial of services, discrimination, or retaliation. All comments, complaints, and grievances will be resolved in a timely manner in accordance with the facility grievance process. Information regarding the grievance process will be provided to me, and the facility's social worker will assist if needed. Now, do you know, again, join us this Thursday, 9 p.m. Eastern Standard Time, Urban Renal Talk with Tamika and Steve. We're going to have on a social worker who used to work for DaVita 2 years, who was blackballed, and who would debunk this, who says that grievances were actually poured out of the grievance book. Clinics had grievance books, patients write grievances. They put it in this book so when the network or the regulatory agencies come through, they can see, you know, if anybody has grievances. Now, you're going to tell me in 1 year, and if the regulatory people come, that the facility didn't have no grievances for 2 years in a row? Are you kidding me? If somebody has an infiltration and complain, that's a grievance. If a staff member talked to somebody wrong and somebody complained about the behavior of a staff member, that's a grievance. Anything, if you fall, if doo-doo is on the toilet, I don't care. If something's out of place in that facility and you complain, that's a grievance. So I encourage you, if you have a grievance, stand up for yourself, document it, put it in writing, keep one for yourself, give one to the unit, agency, the network. Keep harping on it if you don't see any change. Don't get railroaded or labeled as a problem patient when the same company who has the patient's rights and responsibilities. You want me to show it to you? All right. Don't let me just read it. Number 28. Number 28. If you haven't seen this before and you a DaVita patient, number 28. So if they come to you with some bullshit about complaints or say why you complaining about something that's legit, you pull out your patient rights and responsibilities that you signed on your first day and you go to number 28, all right? You go to the administrator, you go to the network, you go to the medical director, who 9 times out of 10 is going to be your nephrologist, and they come to you with some bullshit about why you saying this and why you saying that, and you got a legitimate complaint, you go back to your packet and you pull out your patient rights and responsibilities if you with DaVita, and you go to 28 and you pull this out on them and say this why. Because you said so. That's what the corporation said. You go back and you tell them that's what they said. Not you, but them. And you hold their balls to the fire. Excuse my language, but yes, you hold these guys through the fire. You hold them to what they said. If they say they're a community first and a company second, you hold them to that. But me, I say they are company first, community second. It's not community first, company second. Number 29, you have a right to have all reasonable requests responded to promptly and adequately within the capacity of the facility. You got a complaint. Some patients wait 3 weeks. They haven't talked to an administrator. They got a legitimate complaint and they said something and no one's came around in 2-3 weeks. Bullshit. If that happens, go to the agency. You call anonymously from that cell phone. You see something wrong. You see blood on the machine. You look. You go there, blood on your machine. You see it, blood on your chair. Use the camera. Use the camera. You see something not right, patient fall, or respect patient's privacy. But if you see blood or infection control problem that can cause a patient issue, use the camera. I'm telling you, So, number 30, you have a right to be informed about and participate, if desired, in all aspects of my individualized plan of care. Yes, you can participate in your plan of care. Don't just sit there while the dietitian and the social worker and the nurse and the doctor, they right around there, just talking and talking and talking. Make your voice be heard. If you hear something you don't like, no, change my target weight. No, I want to run this amount of time or this. I think this should happen. We should do this. We need to change that. Don't just sit up there and listen to them because they don't know everything. You know your body. You get the information, you arm yourself through the research, and next time you at that plan of care, you arm with your information. You go to the social worker. Hey, did you check on this? Did this get signed? You ask the dietitian. Hey, what about my phosphorus binders? Did this happen? What can I eat? What alternatives do I got? What's going on with my transplant? Have we moved forward with that? Also, again, you have a right to be informed about and participate, if desired, in all aspects of your individualized plan of care and be informed of the right. You have a right to be informed of the right to refuse treatment and to be fully informed of the medical consequences of refusing treatment or appointment. Number 31. If I require hemodialysis and they don't do reuse anymore, right? But it says if I require hemodialysis, but they used to do reuse. Now, this is how cynical this company is, because they used to do reuse. And those who don't know what reuse is reusing that filter after you finish dialysis. Instead of throwing it away, they take it in the bag and put formaldehyde or a disinfectant in that dialyzer. It says, if I require hemodialysis and dialyzer reuse is practiced in the facility, I am entitled to the following: to give or refuse permission to participate in the reuse program and to request to change from one to the other at any time, either verbally or in writing. Refusal to participate in reuse will still allow me to dialyze in this facility and receive other services. But check this out. Check this out. However, failure to agree to reuse will minimally restrict your choice of a dialyzer. Get out of here. Come on, y'all. After what I just read to you about the patient's rights, 31, if you're on dialysis, if you're on any scale and been on treatment up, you do that Capitol Hill stuff, did you hear what I just read? Did you hear what I just read from a billion-dollar company that pretty much contradicts itself? It contradicts itself. Listen what I just read. 31. If I require hemodialysis and dialyzer reuse is practiced in the facility, I am entitled to the following: 1, to give or refuse permission to participate in the reuse program and to request to change from one to the other at any time, either verbally or in writing. Refusal to participate in reuse will still allow me to dialyze in this facility. Why would they have to put that in that will allow you to participate to dialyze in that facility if you refuse it or in the first place? Are you saying that there's facilities that if you do refuse, you can't dialyze in that facility? Then it says, and receive other services. But then it goes on. However, I'm sorry, guys. I'm being facetious again. Let's look up the meaning for however, because that's a big word in this. However, it's an adverb used to introduce a statement that contrasts with or seems to contradict something that has been said previously. Come on, y'all. Can you read between the lines? Can you read between the lines? Is anybody following me on this and see why I do what I do? Do you follow me? It tells you in 28, you're freely able to express your comments, complaints, or grievances. It talks about your request and all these other rights. And then it comes down and says, to give or refuse permission to participate in the reuse of a filter that has chemicals in it, like formaldehyde. And then it goes on to say, you're entitled to the following. If you want to refuse permission to participate, you tell them in writing or verbally. And then it says, refusal to participate, right? If you're a new patient and you don't understand nothing and you read this, you say, refusal to participate in reuse will still allow me to dialyze in this facility and receive other services. But however, for people, some people may not know what however mean. Everybody is not educated. You do have illiterate patients on dialysis. But when you go to however, it's an adverb. And as it says, used to introduce a statement that contrasts with or seems to contradict something that has been said previously. And this contradicts what I said. It says, however, failure to agree to reuse will minimally restrict your choice of a dialyzer. It's going to restrict your choice if you refuse. So you don't have a choice of a better dialyzer. Thus, your treatment suffers because you can't get a good dialyzer because you refuse to participate in the reuse program. Now, how damn sick is that? And then it says, I hereby acknowledge that I have read and understand the above. But then it says, before that, it says, you have a right, you're entitled to have questions about reuse answered in a complete and understandable way. Then it goes on to say, I hereby acknowledge that I have read and understand the above. I have asked whatever questions I have regarding the patient's rights, and if I have further questions, I will ask them. So if you watch this whole show and you think, I just broke it down to you. Now what you need to do is go and look at, if you go to DaVita, look at your rights and responsibilities. You go to Fresenius, look at your rights and responsibilities. Understand it. All right, I hear you. Share this broadcast. I know it's late. It's 12 o'clock. I'm about to get out of here myself. I thank you guys for watching. Elaine, Candy, Ashley, Warrior. What's up, girl? Do your thing. Absolutely. Thank you, Elaine, for commenting. Ashley, thank you for watching. The 7 people. Yes. You need to know that. Yes, thank you, guys. Hey, Elaine. Hey, Miss Constance. Ashley. Thank you guys for watching. Share this broadcast because, again, hey, thank you, Elaine. God bless you. And that's why I'm on here, to help people. Because like I said in the beginning, I'm just going to be honest. No nurses who work in dialysis is going to be up 12 o'clock, 12:02 at night, trying to hammer this stuff home and to get you to understand. I know this is tedious and all this, and the 7 people, but Elaine, Miss Constance, Kevin, Ashley, who did home dialysis, man, I just hate when people, when they throw all this paper to you and you want to know what's going on, the grievance form, and you may not fill up to it and all that stuff. Yes, there are patients' rights and responsibilities, conduct and all that, but I'm not going to go in that tonight. I will go into it at a later time. And then I'm going to have another show later this week talking about the first 30 days. No one tells patients when they first dialysis, this is like a checklist for the first 30 days, what patients need to know about their dialysis, what questions they should ask, the first week. You can see it right here for yourself, as I'm showing it to you, what you need to know, your diet. And this is just some of my notes that I wrote on it. We did this show before, what you need to know in week 2, what questions to ask. That's what we're trying to let you know. You see my notes, and then second page.
You'll need to unlock your iPhone first.
the third week. I mean, see, he talks about the phosphorus binder. You see the treatment options right here? How many people get known about the treatment options, about home dialysis? I'm telling you, they heard you in. This is some of the stuff that you should know when you get first diagnosed. About travel, if you can still travel. Supplements. Yes. About your access. There's a lot, guys, and we're going to be talking about it. So tune in, be on the watch. I'm going to do this one day this week. Maybe over the weekend, because we got Warriors Quest. I got a show tomorrow night. Oh, yeah, tomorrow, Melissa Tuff. Happy birthday, Melissa. She's going to be on tomorrow night. Kidney warrior, home dialysis patient, motivational, inspirational warrior. She's going to be on tomorrow night at 8 p.m. for Smashing Kidney Disease. That's going to be an awesome show, guys. Then we got Jared A. Brown, Wednesday, 8:30 for Warriors Quest. Then Tamika and I, Thursday at 9 p.m. That for Urban Reno Talk with Tamika and Steve, as we have on social worker Sade Cutler, who worked for DaVita for 2 years, that was blackballed because she was pregnant in the hospital. And this is going to be a show. If you're a patient at dialysis and you always want to know what happened to some of the employees because you never seen them again, or why your request, no one never responded to your request, myself, and Sade are going to share insights. I'm going to share insights from my experience as a nurse at this unit right here at Union Memorial DaVita. It's since changed and they renovated, but I went through this for years, this being like this, okay? It's just trifling in itself. This is, somebody can hit their leg, their back when they sitting down right here. And then we got the dust on the gloves from the drywall, from the ceiling. You see that white powder on top? It gets in the gloves. So, guys, Thursday is going to be the show. All the other and then Uncle Jim. He's going to be on this Friday as well. So we got a whole week of shows for you to enjoy, be inspired, laugh, cry, and just, come together as a community, a kidney disease community where we all are experiencing the same and have great information to live a better life in spite of kidney disease. So, guys, thank you for watching. It's been a blast. God bless you. Stay blessed and encouraged. And I'll see you guys soon. God bless and have a great evening. Peace.
Oh, I've been walking beneath streetlights. I've been walking, cause I can't find peace on these nights. I've been walking, but my strides are getting slower. Still I'm walking, but I don't know where I'm going. I've been looking for love, but only found deception. Told my secrets to some people who have not kept them.
This is the Polish Ambassador, featuring the Grouch and Scott Mace. Don't get it twisted.
I might be conscious, still I like to fuck.
I like it.
Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect. Indulge in deep combo, get hyped when she
It's about to go down. I said, yo, it's about to go down.